Autoregulation, homeostasis, and milieu interior. These three terms are interrelated. When some organ, kidney and other vitals like brain, heart and every other organs, when it has low blood flow, in the face of hypovolemia or blood loss, sepsis, or the shifting of the fluid from the vessels to the other sites, like dengue, we have a decreased blood flow to these organs, suppose in the kidney. So decreased blood flow certainly reduces the less amount of blood supply to the glomerulus, thereby filtration is less and GFR is decreased. Consequence to those events, you have increased sodium and water absorption, chloride absorption in the ascending limb of Henle, and now we have compensatory decreased sodium and chloride load in the macula densa. So thereby the compensatory mechanism is activated. You have increased renin production. You have increased conversion of the angiotensinogen to 1 and 2. We know that angiotensinogen 2 is a potent vasoconstrictor, and thereby it increases intraglomerular pressure, and there in an attempt to retain the GFR to normal. This is called tubuloglomerular feedback. It's important for all the organs. Basically, all the vital functions are being taken care of in this way. Suppose in the brain, if someone has hyperperfusion, suppose in hypertension and other overloaded status, someone has the reverse in hypotension and hypoperfusion, you have the autoregulating mechanism working. So even the electrolytes, sodium, potassium and others, when they are low or raised, the body has the compensatory mechanism to from the suppose potassium, more in the extracellular fluid, less in the intracellular, potassium more in the intracellular, less in the extracellular. They go on shifting each other from this compartment to that compartment to tackle the situation, to maintain the plasma level to normal. This is called your autoregulation and milieu interior maintenance sort of compensatory mechanism set up in all living creatures. Apart from the, suppose if someone feels is not taken plenty water for quite a long, he or she is thirsty, and their ADH secretion is also altered to tackle the situation. So to maintain the normal situation or normal interior status, milieu interior, these compensatory mechanisms, the counteracting mechanisms go on working to keep a human being into normal state.